For the first time in its history, Doctors Without Borders has dispatched a team inside the U.S. The international medical group has confirmed that it sent a 9-person team to help the Navajo First Nation fight the COVID-19 pandemic. Now, it typically only sends people into conflict zones around the world during medical disasters. The Navajo Nation is the largest indigenous community in the U.S. with a population of about 170,000 people. They've already lost more than 100 people. For more on this, we're joined by Dr. Michelle Tom, Navajo family medicine physician. She joins us from Winslow, Arizona. Dr. Tom, thanks for your time today.
Well, thank you for having me on. I appreciate it.
How did you, or do you know how the virus got into the community? Has that been tracked back?
Some of our first cases were in kind of more of the eastern region of the Navajo Nation. That's kind of probably our first cases, but since then it's come from other places which we were unable to trace.
What are living situations like in that community? Is the virus easily spread because of living situations?
Yes. So we found out it's actually spread more rapidly to more people. We have a very strong matriarchal society, so it's a multi-generational homes. So, and very close knit to family ties. So a home could have like a grandmother, nieces and nephews, things of that nature, where it goes anywhere from like 5 to 8 people if need be, just because of the connected family.
So was the Navajo Nation aware early on that there was a virus spreading and the risks associated with that and restrictions that needed to be in place?
Hello?
Can you hear me, Dr. Tom?
Oh, yes, I can.
Okay, so I was just asking you about whether they had enough warning about what could be coming and had time to put restrictions in place.
Well, we kind of got the same warning as the rest of the United States, which was not very much. And so, seeing that we've gotten the same warnings of everyone else, we were trying to be proactive. Our numbers started to rise, and thankfully for our government, we've started to do probably the most strictest shutdowns in the entire United States. Because of that, we started doing full lockdowns on the weekends for 57 hours, and this coming weekend will be our 4th, actually.
So the lockdowns are only in place on the weekend?
Yeah, on the weekends, but also during the weekday where you have to actually be indoors by 7. But on the weekends, it's a complete lockdown. So no one can drive around. And
what is the healthcare system like in the Navajo Nation? Has it been able to keep up with treatment for cases?
No, not at all. Due to the infrastructure over decades, we actually only have about 5 hospitals, and of those hospitals, we only have a total of 25 ICU beds. And so a lot of these beds they're full. And so we end up having to chopper these patients out into bigger cities like Albuquerque, New Mexico, also to Phoenix, Arizona.
Doctors Without Borders sending a team into the community. Do you think that will provide a lot of help, or is more help needed?
I believe any physician helps. However, seeing that these are critically ill patients coming to the point where you need critical care, such as pulmonologists, intensivists, and cardiologists, we actually need the infrastructure of ICU beds. I know we have a lot of docs who want to come and help, but we also need ICU nurses. But then where do we have them if we don't have any ICU beds? So it's an infrastructure issue. So we can stabilize them as much as we can, and then try to keep them as long as we can without intubation, and then actually having to send them out. And
have the communities outside of yours, as you mentioned, Albuquerque, for example, been able to take and handle the extra load?
So far as I know, yes. But I know that people are starting to surge. So we have tried to set up alternative care sites where at least we can kind of house them if their symptoms are not as bad and they don't need quite hospitalizations. Right now, it's a day-by-day basis where some places are full. And right now, for Arizona, we have one phone number we call, which then kind of patches in us into different facilities that can take them.
Got it.
So, yeah.
Dr. Michelle Tom, I'm going to leave the conversation there, but I appreciate you joining us tonight and giving us an idea of what's going on in your community. Thanks for that.
Thank you so much for having me. I appreciate it.